Hi.
Hi, I'm Dr. Radhika, the consultant obstetrician, gynecologist, and a laparoscopy surgeon from Birthright by Rainbow Hospitals, Hyderabad. Today I'm here to discuss about the most common problem what we come across nowadays is diabetes complicating pregnancy. See, when a woman is already a diabetic and planning a pregnancy, what are the things which she needs to take care? So, I will discuss here about a woman who is already a diabetic planning to become pregnant, and then once she becomes pregnant, how do we manage her? So, coming to the first part of this question is a diabetic woman planning for a baby. So, the first and foremost thing is she needs to have a preconceptional counseling done by an obstetrician. That is, what we mean by saying a preconceptional counseling is she needs to understand how her diabetes is monitored now, managed now, whether it is under control. If her blood sugars are under control, then she can embark on a pregnancy. If the blood sugars are not under control, then she needs to make it under control by going to a multidisciplinary team management. What I mean to say is she should be under a diabetic specialist, an obstetrician as well, and a dietitian. And if her weight is a little bit on an overweight side, then she needs to optimize her weight. Then if she is on oral hypoglycemic drugs, then she needs to take the tablets which are suitable for during pregnancy. Then her eye as well as the kidney function test should be monitored before she embarks on her pregnancy. So, till she conceives, she needs to use some mode of contraception so that she can avoid an unplanned pregnancy. So, if the woman is having her blood sugars under control, did have a preconceptional counseling, and she has become now pregnant, how do we monitor her? So, as soon as she conceives, we need to confirm the pregnancy, start her on a folic acid tablet so that this prevents the neural tube defects, that is the brain and the spine defects in the baby, the heart defects in the baby. So, once she is pregnant, she should have her further follow-up in a joint obstetric as well as the medicine clinic, wherein her diabetes as well as her pregnancy can be taken care of. So, once the blood sugars are under control, her pregnancy is confirmed by the scans, then if the sugars are normal, maintained, her eye as well as the kidney function tests are all normal, optimized, then she will be considered as a low risk pregnancy and she will be treated as a low risk. But if any of these above things which I said are not controlled, then we may have to sometimes admit her and then control the blood sugars so that she will have minimal problems during pregnancy and she can have a healthy baby. So, coming to the problems what she may have once she conceives. So, the most important things are during pregnancy the sugars may be uncontrolled, and she may have some preterm labors or recurrent urinary tract infections or vaginal infections, and because of which she may have a little early deliveries. And if the sugars are not controlled, the baby also has some problems such as congenital malformations, or the baby may grow big, what we call it as a macrosomic babies, so that the baby's delivery would be difficult because of the weight of the baby, and there is a very, very high risk of stillbirth or an intrauterine death of the baby if the sugars are not under control. So, the most important thing is we need to monitor her carefully during pregnancy, the preconceptional counseling, so that at the end of the day she should have a healthy baby. Thank you.